Hello, my name is Kelsie Martin and I'm a physical therapist at Braunfels Regional Rehab Hospital in the outpatient department. I'm excited to take a few minutes today to talk to you guys about our new Women's Health or Pelvic Floor Physical Therapy program. So what is a pelvic floor and why is it important to you? The pelvic floor refers to a group of muscles, ligaments, and connective tissues in the lowest part of your pelvis. These tissues work together to provide support to the contents above them, such as your bowel, bladder, uterus, vagina, and rectum. They also lend to pelvic stability, help with the function of pelvic organs, such as voiding and sexual function, and also play a huge role in posture and breathing. So what is a pelvic floor PT? Pelvic floor physical therapists are especially trained in the anatomy, physiology, and function of the lumbo-pelvic region. Just like any other physical therapist, we are trained to identify and treat dysfunction with specifically the pelvic floor as well as the contributing system so that we can have a positive effect on the system as a whole. So what does pelvic floor dysfunction look like? Presents in many ways, but one of the most common that people are aware of is urinary incontinence. Urinary incontinence refers to accidental urine leakage. This can occur with urge. It can also occur with increases in intra-abdominal pressure, such as with a cough or a sneeze or a laugh. And can also occur with functional activities such as walking, standing, lifting, exercise, etc. So although very, very common, urinary incontinence is not normal. Recently, I've seen commercials that are talking about how to deal with the symptoms of urinary incontinence, such as using protective pads and things of that nature. But pelvic floor physical therapy can have such a positive effect that these things are not necessary, and we can even resolve urinary incontinence completely. So many people wonder, what does a pelvic floor physical therapist do, and what does treatment entail? So you may have even heard about Kegel exercises as a means to strengthen the pelvic floor. Pelvic floor PT goes way beyond Kegels. So we, just like any other physical therapist, we look at the contributing systems and see what we can do to have a positive effect on the whole. So examples of common treatments with pelvic floor PT include strengthening of muscles that are weak, include relaxation of muscles that are maybe too tight and not doing their job effectively. We can also use soft tissue manipulation to help with the soft tissues as well as the joints that may be contributing to pelvic floor dysfunction. And then patient education about lifestyle modifications, bladder retraining, all sorts of things that we can do to have a positive impact on an individual's symptoms. Like I mentioned earlier, pelvic floor dysfunction is very common and it affects individuals of all ages. Some statistics show that individuals the age 20 or older, about 25% are having some level of pelvic floor dysfunction. So that means that you or someone that you know may be having some symptoms. Unfortunately, many individuals suffer in silence for years and years. Very often as a pelvic floor PT, I hear, I wish I would have come in sooner. And I think that some individuals are maybe embarrassed about their symptoms or feel that this is something that is just a normal part of aging and something that they're just going to have to deal with for the rest of their life. And some, I think, just don't have an awareness that this is a condition that can be treated with physical therapy. Some people are probably a little scared of what physical therapy entails for the pelvic floor, but I promise you it's nothing any different than what you would get from a therapist working in another part of your body. These are muscles just like any other part of the body, and we'll treat them as such. So I strongly recommend that you talk to your friends, talk to your family, and more importantly, talk to your doctor about your symptoms and ask to have a pelvic floor evaluation and treatment here at New Braunfels Regional Rehab Hospital. I'm really excited to have the opportunity to work with members of my community and help destigmatize and help people feel supported in their care. Thank you.